And you're just going to relax as much as you can.
Oh my Jesus Christ.
Over this way.
Oh my.
Okay. You're tough and you're strong, okay?
Thanks.
There's your affirmations for you.
Yeah. One of the 1,500 that I repeat every day.
What's that, like, the dad, like, talking to his daughter, like, on Instagram? You see that one, like, I am tough, I am strong, I am beautiful.
Oh,
like, you know,
I feel like I know doing their daughter's hair, and they're like, I am beautiful. And the kid will say to the mirror, I am strong.
And they got, like, the cutest, they can't even say the words.
They're like 4.
Hey guys, so we got a really exciting patient in here today. She's a TikTok influencer, but more importantly than that, she has a great cause of what she's doing with her audience there. So I really strongly recommend that you watch this one all the way through and that you listen to why she's doing exactly what she's doing. Spoiler alert, has to do with mental health, a little bit sensitive, a little bit of a trigger warning, but I can't say enough positive things about this person. So please don't forget to like, comment, and subscribe. Really helps out my channel, and I'll see all you guys later. So this is my new patient and friend, Taylor. All right, Taylor is, I guess, would you describe yourself as like a TikTok influencer? Like, well, how do you want to be described?
I guess social media personality, I guess you could say.
We'll take that.
Yeah,
sure. Yeah,
sure.
With
Fitness,
with
social
a
media.
Passion for fitness, right? Consistency, passion, exactly.
Yes, very much.
In today, do you have any actual acute complaints, or like, why is it that you've been wanting to see a chiropractor?
So I did physio a few years ago. I think I was 14. I'm 21 now, but in the moment, I just noticed because I was a competitive dancer for I want to say 14, 15 years.
Very impressive.
And so I started very, very young. And when I became more serious about it, I noticed that the stretches and all that stuff had a really negative impact on my body.
Really? Okay.
Yeah. And so ever since then, I've had a really tight, he said years ago it was a tight piriformis.
Okay.
Which I don't know if it actually is, because I was doing the stretches at the time. It worked for a short period of time. I kept doing them, and then it eventually just came back again.
It just came right
Yes,
back.
exactly.
Okay.
So for example, like when I get like a massage therapy, I can't have too much pressure right here. Like right in the very back, right here.
Come around and, like,
yeah,
take
totally.
a look.
It feels like needles
so
almost.
Right there specifically.
Like here and then right
lower down.
Yeah, so
well,
right here, exactly.
Okay.
And so I've started to, strengthen lower back muscles or my core muscles to see if maybe my glutes were overcompensating for it.
It's really interesting. Do you actually mind turning around and facing the wall just so I can show the camera this? So, can you trace exactly where you just traced for me?
Like here.
Okay, so she's actually above her piriformis muscle. Her piriformis muscle is down here. This region, when we kind of snake upwards like this, she's looking more to her SI joint, okay? The bottom of the spine is that sacrum connecting into the ilium or the hip bone. Sacroiliac joint travels like this. So it's possible that we're actually having some sacroiliac lockups. So we'll take a look at that.
It was actually a few weeks ago when I was doing elevated heel squats on the Smith machine.
Got it.
I was shifting a little bit to one side. Like I wasn't going. I can't remember if I was shifting to the left or if I was shifting to the right, but I remember I wasn't keeping a straight line when I was going down. That is one thing I noticed.
So first thing I'm going to do is kind of check the range of motion of your hips. Okay? I'm going to take this, and what I'm going to do here is I'm going to rotate you inward like this.
See, that feels uncomfortable.
Where do you feel that right
in
now?
My hip.
Right kind of in the hip
right
area
in my
there.
hip.
Okay, so we're about to get to 40 degrees.
Anymore.
Let's try it over here. So I bring this up, rotate.
That feels okay.
That feels okay.
Yeah.
But
it doesn't feel as restrictive as the other side.
So, quick question. Sorry, which way were you leaning again when you were squatting?
I think I was leaning to the left, but again, it was mid-set, so I wasn't fully focused on it.
Okay, one more time. I'm actually just going to check this range of motion from this angle instead, because I want to be sure on this. So one thing I'm noticing is that you do have less actual rotation in this hip as compared to the other hip. So I know that you might think, pain's on this side, so this is the issue. Not always the case, okay? It could be you get discomfort in that side just because we are bringing it to the actual end range, and that's causing a pinch, which is pretty normal. But there is a hip opener that I'd want you to try that I'll show you later. So my hands are going on your back now. Okay, if for whatever reason you want them off, the word is stop.
That's okay. Yeah, no, I don't mind.
All right, so kind of...
Yeah, like...
Oh, really? So that spot right there.
That hurts right there, yeah.
Okay, so that is bang on the SI joint.
Yeah.
Okay, that's exactly what I was talking about beforehand. This might actually be a pretty open and shut case. And you're how old? 21?
21, yeah.
21-year-olds usually don't have the most complicated stuff going on, especially if it's related to, like, exercise-induced issues. So that there. What about on the other side?
It still hurts, but it's not
as bad, Okay. So we're going to go ahead and climb up the low back here. So to me, I feel tension in through this lower upper back. I don't know if you feel irritated at all when I'm poking through
it
here.
It feels like more like tender, I guess.
Yeah, definitely. So this is why it's good for them to always check above the chain of any area that you're actually having an issue with, because there probably is compensation going on that your body isn't even aware of. Our bodies are really good at hiding this stuff right up until they're not. So definitely tension, more so on the left side I'm feeling here. I'm going to get you to take a big breath in for me. And all the way out, all the way out. Ooh, in. All the way out.
Oh my god.
There we go. That's what we were looking for.
That was crazy.
So you now with, how many followers do you have on TikTok?
695K.
695. That is insane.
Something
well done.
Like
You're trying to harness that into a business then, yeah?
Exactly, yeah.
So
use it as leverage.
What is your TikTok handle, your information there, so
It's
that
just
anybody
my
watching can click?
First and last name, but with 2 L's.
2 L's
Yeah.
instead of just the Taylor, right?
Yeah,
So
that username was taken.
I guess that would be Taylor Berry, like the
Yes,
fruit on
exactly.
TikTok there. That is something that y'all can look up if you're interested in online personal training, guys. How did you find your kind of passion for fitness?
Well, I just had a really bad year with mental health when I was 15.
Okay.
Right there is the pain.
Yeah.
With mental health and my... sorry.
I'll back off a bit. That's okay.
No, sorry. Just
I ask you questions to distract you.
Yeah.
Yeah.
But yeah, I just had a really bad year with mental health, and I was kind of forced because my parents knew the benefit of physical activity.
Are your parents very active people?
They are relatively active. Yeah, my mom more so because she's really into like volleyball with all of her girlfriends.
Okay.
And then ever since then, I just, my lifestyle kind of adjusted to, health, wellness, fitness, and ever since then, it's just kind of grown into more of a lifestyle for me.
At least in a population of teenage girls, exercise is as effective for mental health issues as prescribed antidepressants. Okay, so if you are, or you know somebody who happens to be a teenage girl and is struggling with a bunch of mental health stuff, highly recommend that you somehow get them physically active.
Physical activity was like the only thing that really saved my life, essentially, because of how severe my mental health was at that time. I started going every day, and I eventually was able to come off of my medication.
Okay, so Taylor, first off, thank you for sharing that, because when someone says that physical activity saved their actual life, that's not necessarily hyperbole. Okay, so like good on you that you can say that now, and hopefully if one other person watching takes that idea away, that's good.
Well, that's something I want to be an advocate for. I want people to know that like even though someone's big on social media, they still have like things that they can relate to. That's what I want to be. I want to be relatable and know that like if you're going through something, like there's still other people out there that are going through the same thing, and you're not alone. That's why when TikTok was about to get banned, I was like, this is not good for people's mental health because it allows people to relate to others' experiences. So that's why I try to promote fitness on my personal page, because I want people to have an outlet of someone they can relate to.
You're going to go far. Okay. So I'll get you to hold right there. Yeah. Again, she's never been adjusted before, so we're going to contact that SI joint. Okay, I'm going to bring this leg here. I'm going to get you to scoot your hips closer to me, please. Good. Now what I need from you is I'm just going to roll you towards me, and you're just going to relax as much as you can.
Oh my Jesus Christ. Sorry.
That's okay.
Woo, that was crazy. And I was worried that like nothing was going to happen.
Well, don't you worry. That's my job to worry about it. All right, I'll pull you over this way. Okay, I really feel like that needed to go.
That was so good.
What I need from you to get this to go is I'm going to get you to turn your head as far as you can to the right, and then just pretend that you're on your pillow at home. Okay, good. More.
Oh my gosh.
There we go. You needed a little bit more oomph. I tried to be gentle on that first one, but how was that? You still breathing?
Yeah.
You're good.
Still alive.
Yeah.
Mostly. No, I'm kidding.
No, I hope
great.
Entirely, truthfully.
I'm great.
Yeah.
It's not as intimidating as it looks, though. That's one thing.
Yeah, a lot of people get really freaked out sometimes watching
Yeah, that was
videos,
not bad at all. I've seen the videos and I'm like, oh my god, it looks like their head's about to come off. And then just now, great.
You usually
still living, still breathing.
Good. You can see she can still wiggle her toes, right? Oh, thank God.
Kidding.
Okay, the wiggling's there. Okay.
Yeah. You're like, yeah, it doesn't feel as intense on that side.
No, your right side is definitely
But it is
better.
definitely in the trap right there.
Like as we get lower down?
Yeah, like as what you just did before, maybe a little bit higher than that. Like right there.
Right there.
That's where I feel it mostly.
Okay, that's more of a C5 concept. Just gonna relax there. There's a little one right there. Yeah, definitely not as bad as your lower back, but that makes sense because you don't have too many issues up here, if any at all. But you definitely had some lockup, so glad we were able to get to that. You were brave. Well done.
Thanks.
You should have stood up for me.
It's a little difficult not to gasp, though, at least. That's all I can say.
You're not used to it, absolutely.
Oh my gosh. Whoa.
I remember when we were learning how to do necks in school. Oh, that was a frightening time.
Yeah, I bet. I'd be scared I'd accidentally dislocate their neck joints.
Well, don't do that.
Oh, right there, yeah.
Okay. So yeah, you do have that tension still in the upper traps. Do you see a massage therapist or a physio or an osteo or anything on a regular basis?
I occasionally see a massage therapist,
Okay.
yeah.
How often is occasionally?
Every few months.
Every few months.
Yeah,
okay.
not too much.
I'm going to get you to look up into the left for me, okay? There you go, crush it. And now slowly down into the right.
Oh. Yeah, that's really tense right there.
Yeah. Up and to the left, down to the right. That's a noise that most of my patients make. Ugh. Ugh. It's like they're disgusted to be here. You know?
Not here, just the
No,
pain.
I know.
So this is fantastic. It's painful, but it's good.
It's a good pain.
Yep. No pain, no gain.
You're tough and you're strong, okay?
Thanks.
There's your affirmations for you.
Yeah. One of the 1,500 that I repeat every day.
I am tough.
I am tough. I am strong.
What's that like the dad like talking to his daughter like on Instagram? You see that one like I am tough, I am strong, I am beautiful.
Oh,
like, you know,
I feel like I know it's like a trend that even like parents will do with their kids like when they're young.
Yeah.
They're doing their daughter's hair and they're like, I am beautiful, and the kid will say to the mirror, I am strong.
And they got like the cutest. They can't even say the words.
They're like 4. You
better that
say
they say it bad than ugly, right?
Because when you're young, it's most important that you're repeating those things.
So I'm going to get you to take a big breath in.
Ooh, that feels funny. Right?
Oh, great.
It doesn't hurt. It doesn't hurt. It just feels weird.
It doesn't hurt yet.
No.
Okay. You got your tough girl face on, I can tell. Yeah. You're going to lift this leg straight up 5 inches. There, keep going. What do you mean you can't? Look at that.
It hurt.
Good. And slowly lower. And again, go ahead. You can do that 9 more times if you can, okay?
Okay.
I lost count though, so.
Yeah, I'm not gonna lie. So
3 more.
Yeah.
That's the magic number. If your practitioner says 3 more, it means they weren't counting. Yeah.
The cupping bruises. Yeah. I'm curious as to what your opinion is on that.
It's totally normal. So the cupping, it works the same structure as these tools. I just prefer the tools because it has more of a massage effect to it. Okay. But what's happening with cupping, which I have one right here, is that you're working a tissue called your fascia. Okay, so fascia, it's a connective tissue layer that exists underneath the muscle. Okay, that responds well to this kind of like hickey-like sensation. Okay, granted, I use a lubricant and it slides. Right, that when the fascia is worked causes a micro bleed. It is technically a bleeding. Okay, occurring at the level where you get a tattoo. So it's completely harmless, it's completely benign, unless you have a history of kidney disease.
Okay.
Do you have a history of kidney disease? No? Then I'm not worried about that today. Okay. But yeah, it can be a little bit concerning the first time you see it. I just prefer doing the tools. It has the same mechanism of action, it treats the same structure, but it adds more of a massage component to it.
So they do essentially the same thing, they're just more different techniques?
Yeah, exactly.
Okay.
I prefer the tools again because there's more of a muscular component to it. Plus I can go everywhere with it. Right. Whereas the cupping, like you're kind of limited just to where you stick it.
Yeah, exactly.
Right, you can't slide the cup, but I prefer this.
It doesn't feel as tender, right? Okay,
yeah,
gotcha,
like the pressure-wise, like this already feels more not uncomfortable, but you know.
So patients reporting a noticeable change in sensitivity between the sides. That's to be expected given the history of everything being left-sided. We're just going to work our way kind of from here all the way up to probably here, okay?
I think I can speak for women, but I know that a lot of women go with like the phases of, I'm just starting, I don't know anything, so all I'm going to do is glutes, cardio, and abs.
Oh,
and
That reminds me of every woman who started working out ever.
Exactly. So it's like you hit the first, like the 3 most random days, and that's all you hit, and then you're not noticing any growth.
Granted, when you're a guy, it's just arms, chest, and probably arms again.
Exactly. So that's kind of, it's more of just the process of becoming more like I love upper body days now.
Do you?
I love shoulders.
Oh, aren't you a rarity? That's good.
One of my favorite days. I've always said, if legs is your favorite days, you're not doing it right.
There is work to do on both hips, for sure, right? I feel like your hips have issues that are definitely contributing to issues above the chain, especially on that left side. That's why we have so much more tension on that left side. But overall, I think that was a fantastic start. We did a lot. We adjusted. We did a lot of soft tissue work.
Yeah.
We went into the gym. Unfortunately, the lighting in there is terrible, so I didn't film that one. We went to the gym, figured out a good hip opening exercise. Question: the physio that you saw before, the massage therapist that you've seen before, did they kind of do that much inside of their appointments for you, or not particularly?
No.
Okay.
I only recall ever having one adjustment, not like a session, like literally one just movement. Everything else was just stretches.
Okay.
And I don't really like doing just stretches because again I like to stick to my like workout routine, and I know it's important, but sometimes it's easier to be more accountable when someone else is helping you in the moment.
Of course. If you have somebody who's like pushing you forward.
Yeah, exactly.
Stretches are a great tool for for aiding against issues. Like again, if her issue is having that hip open up, we have to stretch them with the hip before we exercise. Simple, right? But stretches alone aren't enough. Okay, you always need a little bit more than that.
Yeah.
Anyways, did you have any last minute questions for me before we sign off for today, or?
Not necessarily. No.
Okay. What I just wanted to say is, you've got a great following on TikTok, but more importantly than that, you seem like you really want to use it for helping other people.
100%.
In terms of, like you were saying, you chose a very like noble cause, mental health in young girls. That's something you could obviously relate to. So in case you haven't given yourself credit today, give yourself credit, because that's we need more people like that. You know, I think when a lot of people think social media, TikTok, that kind of stuff, they think bad, China, whatever. But like, you're using it for a good purpose.
Yeah.
So thank you for doing
I think it's more than just an app that people can be on. I think it's actually like a community. You know, like it's not just what high protein meal can I make this morning? It's I'm feeling very lonely. How can I combat that? You know.
Thank you for that. As somebody who has a younger sister.
Of course, yeah.
All right.
Yeah.
So appreciate you coming in.
Awesome.
Have a great
Thank
rest
you.
of your day.
It's nice
We'll see you
meeting you
soon.
guys.